everyone, welcome back. It's me, Theresa Callard-Moore, continuing to read BridgeIT, the Integrative Medicine Approach to the Healthcare Crisis in the United States. We're almost to the end of the book now, and I think we've seen some of the ideas I've thrown out there, certainly how we've gotten here. But let's move on to Toto. I think we're not in Kansas anymore. The United States is in the midst of a perfect storm. We are faced with the loss of income, all the taxes and healthcare costs. We're not able to budget for healthy foods because we're strapped by other financial obligations such as car and house payments, medical bills. In our belief system of having our power over our healthcare given to our employers and insurance companies and now the government, it's easy to see why our substance and process addictions, meaning work, money, eating, sex, are so high. Yep, we're back to sex. Because if your health is not in balance and you're stressed out, guess what area gets affected first? Sex. In my practice, I specialize in sex addiction, but I can tell you the telltale sign of addiction is the difficult task of taking responsibility for yourself and your feelings. It is a way to escape them, according to the National Institute of Health. Substance abuse and other addictions have cost nearly $740 billion annually in costs related to crime, lost work productivity, and healthcare. We all know someone who struggles with some kind of addiction, and if your family is anything like mine, there are several. We need a new way to address this very complex problem of addiction in our healthcare, which is going to require us to look at ourselves in the mirror and face these misguided beliefs and behaviors. But how do we start? I came up with BridgeIT, but I'm open to any ideas that work. That's how I found Eat Well, Move Well, Think Well by Dr. Chester and Baxter in Canada. The next chapter is all about that tool that I found through them and the system that they're using, which I'll get to next time. But we really need to see how this affects us in a general way, but also with the opioid crisis that we had before Corona hit. We have such a tendency to turn to a pill when we have a problem that's what we do when we are stressed for any other reason too. We want to turn to a pill or chocolate cake or some kind of grinder app that we're looking up things and trying to make ourselves feel better. I see this every day, and it is the inability for us to cope with our own feelings and deal with our health on a primal level. What we need to do is take care of ourselves and stay in balance somehow. That's why I like this integrative approach. I personally really struggled with my career versus this book because I don't ever want to leave my career. I love my patients. I love the work I do every day. But when I realized that this philosophy we have about not taking care of ourselves is really the cause of addiction, I realized it was together. I wasn't giving up. There wasn't an either or. It is the problem. That is the problem. So if you like what we're doing, feel free to give me a like and subscribe to the channel. We're almost to the end of the book, and I can't wait to tell you about Dr. Baxter and Dr. Chestnut's work in Canada. I love what they're doing, and I'm so excited and hope to be working with them doing the project that I did for my study, which was in the book. Thanks again, you guys. I'll talk to you soon.